Morning, morning everyone. Hopefully everything is good. I'm in my new setup, so fingers crossed that everything's working. Everything's looking good my end. So if you could drop me a message, that'd be good. I'll just pop a message into the group. Had a very disappointing comment the other day. Somebody didn't like the music for the intro. Only 150 episodes I've been using that for, and then finally someone doesn't like it. Oh well, if you can always find another anatomy teacher, I guess, if you don't like the music. There we go. Right, let's have a look. Everything is looking good my end. I just wait for a comment to come through. Yay, Mo, good morning. Good morning. Right, you're our test, so we're going to get going. Here we are. So we finished the ankle and foot, and yeah, now we're moving up the body as we've done 4 times already. So this is our 4th time around. Saying that this will be the last time that I'm going to go through the whole body. So basically go through the knee, and then we go into the hip, lumbar spine, sacrum, thoracics, ribs, then up into the neck, and then we go shoulders, elbow, and then down into the hand. So it takes about 18 months to do the whole thing. And we've got some, we've got some things to still cover that we haven't covered previously. So I've got I've done some sessions where I've gone really in depth on things. So we had a whole session on cranial nerves, and that took 9 weeks. So I'm not doing that again. I've done it, and I've edited it, and it's available now for you guys to watch. So yeah, that stuff like that, where it's like the really tricky stuff, I've used that footage from the previous sessions, the live sessions, and then edited it and cleaned it all up. So yeah, so I'm going to stick to the kind of bread and butter musculoskeletal stuff. So so I don't have to revise before I teach. Okay, so yeah, so knee today, and again, if you've not really done work with us before, then we go through bones and joints, then we add on connective tissue, and then after the connective tissue, then go muscles, tendons, and then we look at the nerve and the blood supply for the region, and we show how it links up to the previous region. So obviously we've just done the ankle and foot. So by the time we get to the nerves and the blood supply, you'll see how it all kind of connects into the ankle and foot. So that's the plan. Yeah. Thank you, David. Morning, Tris. Yeah. Exactly, David. Yeah, exactly. Good morning, everybody. Right, let's get you going. Just find my slides. There we go. So yeah, knee and bony anatomy today, and I've got a really good model. Let me just show you this. I've been started. These are really blooming expensive, but they're so good. So this is the anatomy model from 3B Scientific. I don't get any money for advertising them. I just think they're good. And these are all the muscles and connective tissue that attach to various bits. And so what we'll do is we'll start to add on the layers on the model, as well as with the videos and the PowerPoints and stuff. Yeah, just like I said, I think this one was about £200 or £300. So it's not cheap, but it is really, it's the best model I've ever found, to be honest. So obviously I've stripped everything off, and we're going to start with the bones. And then as we go through, so next week looking at connective tissue, and then I'll start to add on the connective tissue, and then how the muscles then layer on over that. And the good thing is with this, you can see the way that the muscles, especially the muscles, are layered on top of each other, so their relationship to each other. So we're going to be using that as we go through these sessions. Right, let's get you going then. So I've got apologies if you've done this before, or if you've been qualified for a while and you're thinking, oh, I don't need to know the bony anatomy, because there are some people that join us and they've never heard of stuff before. So we're going to start right from scratch again and build it up from there. So that's the plan for today. So there'll be some things where you go, yeah, I know that, but yeah, there'll be some things hopefully where you don't. Right, so let's get rid of that at the bottom. We've got 4 key bones that we're looking at when we look at the knee. We've got this one here, which is called the femur. This is your thigh bone. So on the model, it's the top bone just here. So if you put your hands on your thighs, that is the bone that's underneath all of those muscles there. So that's your femur. Then we've got the tibia, which is your shin bone. So that is this one just here. Okay, so that bottom part of the bone. Just going to make that camera view a bit bigger on this. So that one there. Okay, and then the fibula is next to it, is that one there. Okay, so this one's quite small. This one's quite chunky. Okay, so this is your main kind of shin bone, if you like. This one on the outside is a very thin bone on the outside, but it's still a synovial joint with this one at both ends. We've had a look at the other end when we looked at the ankle. And then the patella, which isn't on here at the moment because it is in this. So if I turn that around, there's your patella. All right, so we'll stick that on at some point. The patella sits in, well, you can see it on this picture here, sits in 2 tendons. So we've got a muscle at the top here, and we'll talk about the muscles and which ones they are later on. Then there's a tendon. Then the patella sits in that tendon, and then there's another tendon there which attaches down to here. All right, so that's why it's not on this bony model. What you may see on some models is where it is stuck on, but then it doesn't really move, and you can't see the relationships. So again, that's why this one's pretty good. So yeah, femur, thigh bone, tibia, shin bone, fibula, the one on the outside of the shin bone, and then your patella, which is your kneecap. All right, so those are the 4 key areas that we're going to be looking at today. Hopefully we'll get all the bones and joints done today. We've got several joints in the knee. Just make that a bit smaller again. And we've got these 3. So we've got the tibiofemoral joint. So there's your tibia. And this is the useful thing about learning the bones first. Because when you learn the bones, the joints make sense, the name of the joints, that sometimes they seem really long and you're like, oh my God, how am I going to ever remember that? But if you know which bone is which, then you can work out where the joints are and which bones are joining together. So the tibiofemoral is your tibia and your femur. All right, so that's your kind of what you would class as and what you would think of if you've never really studied anatomy before as your knee joint. Yeah, so it's the bit in the middle. So that's this one here. Then you've got your patellofemoral joint. So that's the joint between your kneecap and your thigh bone. And there's specific shapes to these bones, especially these joints here, well, and the femur as well, actually, in relationship to the tibia. And we'll explore those because they're different sizes, different shapes, and they all kind of fit together to bring about certain movements. All right, so there's a reason for their shapes and their size. And then at this end, we've got the superior tibiofibular joint. So that's your fibula, that's your tibia. So this joint in here, it does move. That it's called your tibiofibular joint. And down the bottom, near the ankle, the bottom part of this bone turns into your lateral malleolus. And if you've never heard of that before, go and have a look at the anatomy of the foot, the bones and joints of the foot, which we did probably about 6 weeks ago. All right, so you can have a look at that. And that attaches to the tibia, but lower down to form the joint of the ankle. All right, so we've done the distal end, the inferior end, so the bit down the bottom. Now we're looking at the superior end, so the bit nearer the top. All right, so that's that bit there. So superior tibiofibular is your tibia and your fibula where they join. All right, so those are your three knee joints, and these joints are held together by ligaments. We're going to go into those in a bit more detail over the coming weeks. But you may have heard of some of these ligaments, especially if you follow football and your football injuries and that kind of thing. So the joint itself is a hinge joint. So again, you kind of imagine it as if it opens like a door, but it doesn't. As it opens up, it also rotates. So there's a bit of rotation with the hinge, and we'll talk about that as we get into when we get into the connective tissue. Okay, so things like the meniscus in between the knee bones. There's an articulation between the femoral and the tibial condyles. Condyle means a knuckle. All right, so and it's shaped like a knuckle. So if I just make this one a bit bigger here. Okay, so these bits here, these are the knuckles either side. So you can see how they're bigger than the rest of the bone. And I've described it like like a cartoon bone, where it's thin in the middle and then it's got these bulbous ends. Those bulbous ends, those are the condyles, those are the knuckles. Obviously they're not as exaggerated as in the cartoons, but they're like this, okay, here and here. And you've got condyles on the tibia, okay, so on this shin bone, and on the femur, on the thigh bone as well. And they're given specific names due to their location. So when something is on the inside of your body, that's called medial. And when something's on the outside of the body, it's called lateral. So we have lateral condyles and medial condyles, okay? So that we can distinguish between the two. And these joints, so where the condyles meet, so the tibial and femoral condyles, we've got ligaments that hold those bones together. And the main ligaments that we're going to have a look at in the coming weeks is your cruciate ligaments. And cruciate means across, so they cross each other. And then we've got medial, so inside, and lateral, outside, collateral ligaments. And these are ligaments that go up and down the side of the knee to prevent the sideways movement of those bones. So if that knee joint is there and I do that, there's a ligament here that stops it from doing that. And then there's another one on the other side that stops it doing that. But when you get injured and someone hits into you or you fall, you can move those bones into that direction and open up that joint, and then that starts to irritate, or if it's minor, or it can completely rupture those ligaments depending on the force that's going through your knee. With the cruciate ligaments, they're on the inside. Again, like I said, we'll talk about those in a bit more detail in the coming weeks. But if I just show you here, you can just about make them out in there. So you can see these plastic bits here. That's the cool thing with this model. You can see them bend and move. Yeah. So these are your the collateral ligaments, and then on the inside you've got your cross ligaments, your cruciate, and they help to prevent twisting. Okay, so twisting of the knee like that. It's not supposed to twist that much. There is a little bit of a rotation in it, but not too much. And if you go too far, then you'll damage the ligaments. So yeah, just a brief introduction to those. So they hold the tibiofemoral joint together. So the tibia and the femur, they hold those two together. And then your patellofemoral joint. This is another synovial joint. It's a gliding joint, and it's the articulation, which is the join between the patella and the undersurface of the patella. Okay, is got a specific shape, so we'll have a look at that, and the femur. All right, so the thigh bone as well. So let's have a look at some videos of those. So this is the femoral condyles. Okay, so these are the knuckles at the end of the femur. Let's have a look at these. And yeah, I've not explained this one, but hopefully it makes sense from what I've already explained. So there's a word here which is a really long one, intercondylar notch. And again, you think, what the hell is that? But if you know what the condyles are, then if we've got something that's intercondyle, then that's in between your condyles. And a notch is like a cutout piece. Okay, so there's like a dip in between. So we'll have a look at those. So you've got your femoral condyles, which are the two knuckles, inside and outside ones. And then we've got the intercondylar, which is the bit in between notch. So there's like a bit of a dip. All right, so let's have a look at those. Morning, Rahul. Good to see you. Good afternoon for you. Okay, so here are your condyles. I'm just going to pause that there. So this is the outside one. So this is the lateral one. Like I said, condyle means knuckle. And then if you notice on here, well, you will notice because I put a massive, great big red arrow, the medial condyle is bigger than the lateral. So you see how that drops down a little bit lower there, and this one's a little bit higher there. So this is important for later. When we start looking at something called the screw home mechanism of the knee, yeah, the reason why we get that mechanism is because of the shape of the condyles and the fact that this one is a little bit bigger. So we'll look at that in a bit more detail when we get to it. So this is the outside condyle. This is the inside one. So lateral and medial condyles. And then the bit in between, that's your intercondylar notch. So it's the kind of dip in between the two, just there. Nice and easy, okay? Nice one to start with that, nice and easy. Okay, so let's have a look at this next bit. So we've got the, this is the join between your fibula and your tibia. So there's your tibia, so that's your shin bone. Fibula just there. And then that join just in there. This is another synovial joint, so it's got synovial fluid in it, which means it can move. It doesn't move very much, okay, very far, but it can move backwards and forwards. You can grab hold of this part of the bone, and you can wiggle it backwards and forwards. Okay, you can mobilize that, no problem at all. There are muscles that attach onto it, and we'll talk about that when we get to the muscles. And sometimes those muscles can restrict the movement of the bone, and then give it a bit of a wiggle, and it's all good again. Okay, so that might be an area that you've not really thought about looking at doing any treatment on, but you can. Yeah, if the joint's not moving very well, then you can give it a wiggle and it will start moving again. Because it's attached down to the ankle, the fibula kind of glide. If I go that way, it glides backwards and forwards. I mean, that's excessive movement there, but it will move. Okay, so when you pull the top part of the fibula backwards, the bottom part of it can move forwards, and then vice versa. All right, and it's supposed to have that kind of seesaw rocking action. That's normal for that to occur, but not, again, a couple of millimeters, not very much. The articulation between the proximal tibia and the fibula. So proximal means closer to the body, distal means further away. Okay, again, apologies if you've heard all that kind of stuff before. So then once we start to know the bones and the joints, we can then start to look at the little bony landmarks, and these are little projections on the bone where things attach to. So it's useful to know where these are, so then when you do the next layer, you're like, oh yeah, that attaches onto that bit. And some of them are really useful to, if you're examining someone's knee, then you use bony landmarks to know which part of the knee that you're touching. And you can, there is a really good book called The Trail Guide to the Body by Andrew Beale. It's Biel. And in his book, it literally shows you, right, if you know where this bony landmark is and then you go medial, then you'll get onto this bony landmark, and then if you go superior, you'll be on this bit. And it literally takes you through a trail guide to that particular region. Okay, so that's really quite useful. And these are some of the ones that you might find useful. Some of the things that I'm going to show you, you can feel, you can palpate them. Some of them you can't, they're a bit too deep. So yeah, you can have a look. And I'll let you know. But if you have a look at that book, it will explain them all. So your femur, thigh bone, we've already had a look at that and what it attaches to. It's a long bone, classified as a long bone. So long bones are longer than they are wide. That's basically the definition. Longest and heaviest bone in the body. And distally, so at the end of it, it joins, so it articulates with the tibia, and we've already seen that. So that's your tibiofemoral joint that we saw before, and it also articulates with your patella. Okay, so this bone just here. The patella, like I said, has got a specific shape, and we'll have a look at that in a second. So you can see how it sits in between the condyles, all right, and how it then moves in between those. Weirdly, with the patella, the base of the patella is at the top and the apex is at the bottom. And I think it's just because of the shape. Yeah, so the base here is a little bit, you'd expect the base to be at the bottom. It just is the usual way that you would think of the base of something. But I think it's because of the shape. So it's quite flat here. And then the apex of the patella is quite pointed towards the bottom. And the muscles up here, they turn into a tendon, and then the tendon attaches all into the top of the patella and then goes over and under the patella and then comes out at the bottom around the apex. Okay, so that's sitting in that tendon. And then there's your condyle, so your lateral one on the outside and then medial one on the inside. Okay, so that's those two which we've already had a look at. And then on those condyles, and that's why it's useful to learn those terms first, we've got these things called epicondyles. And epi means upon. So when something's on something, it's an epi. And an epicondyle is another bony projection that is on top of the condyle. Okay, so we've got a lateral one, so one on the outside, epicondyle, and it's just this little projection just here. And that's useful for when we start to learn the muscles, because there's muscles and ligaments that attach onto these condyles and epicondyles. Then this side, we've got the medial epicondyle just here. Okay, so we've got these little projections where things attach to. Now, you may have heard this story before if you've been watching me for a little while, but if you don't know, your bones are really smooth when you're a baby. Okay, they don't have these bony lumps because we haven't moved yet. It's only when we start to move and we start to develop that where the muscles attach, or the ligaments attach, they pull as you move because you're stressing those structures, and then your body then develops to withstand those forces. And then that is why you've got certain bony lumps on certain bits, because it's where muscles attach or ligaments attach, and then as you develop, they're starting to pull on the bone, and then the bone will get thicker so that it can cope with the forces going through it. And that's why we get these bony landmarks. Okay, so there's a reason for it. It's useful when you're palpating because you can feel certain areas to see if they're tender, if that's where somebody has got some discomfort. Okay, so useful to know these regions. And then this one apologies, but there's loads of information on here. So what we'll do is we'll go around this side, and then show you a couple of videos just to kind of tie everything up, and then we'll go around the other side. Okay, so here is where your intercondylar notch will be on your tibia. Okay, so this is the shin bone now we're looking at. There's your fibula, just down the side there. And you've got a lateral and a medial condyle on the tibia. So the notch bit is in the middle of those on the tibia as well. Okay. Then we've got the lateral condyle here. It's not so much of a big knuckle shape as the femur. Yeah, it's a bit different to the femur. That it's still a condyle, but it just looks flatter. Okay. We've got some little spots in the body that are named after people. This is Gerdy's tubercle, just here. Okay. And that's important for when we're looking at some of the muscles that attach down into this area and where connective tissue attaches. The head of the fibula, so that's the bit I said you can grab hold of and give that bit of a wiggle. There's some muscles that attach into there as well, and some ligaments. Then we've got this main one here. Now, you'll be able to feel this one on yourself. So if you have a feel of your patella, and then slide your hand down your patella, there'll be, if you push in towards your shin, there'll be a little bit of a soft squidgy area, and then if you keep going down, in right off the apex of the patella and then down, you'll meet this bony landmark on your tibia, which is just here, and that's called your tibial tuberosity. Right, so there's lots of different names for lumps and bumps. So we've got condyles, epicondyles, tuberosities, there's trochanters, there's tubercles. They all basically mean little bony lumps, okay? And depending on the size of them, depends on their name. So the tuberosity is usually a kind of medium-sized lump, okay? It's not huge, but it's not really small that you can't feel it either. You can usually feel it on most people. And that is where really big muscles from your thigh attach into this point here. All right, so again, that's quite useful. You can get a condition as you're growing around about teenage years called Osgood-Schlatter's, and it's called a disease. It's not really a disease, but it's where the tendon will pull on this attachment point and it will irritate it, and sometimes it will pull the bone away. Yeah, and then you get it's really quite sore. You get lots of inflammation, but then after it's been pulled away, the bone will then fill in where the gap where it's been pulled off. Okay, so you get a really knobbly knee. It's usually if you're quite sporty, do a lot of jumping sports like basketball or volleyball, that kind of thing. Okay, so yeah, that's again useful to know so that you can when you're doing an assessment to see if it is that particular condition. And then down here we've got the shaft of the fibula. So this is your main part of the fibula bone. Okay, had enough of me a little bit. Let's have a look at these just to recap some of them. So we've got the epicondyles, and then another name for something, supracondylar ridge. Right, let's have a look at that. So just pause that there. So this is your lateral epicondyle. Medial epicondyle will be this side. And if you think about those words we were using before, superior and inferior. So if something is superior to something, then it can also be called supra. It's shortened to supra. So where there's a condyle, so the in this case the lateral condyle, there can be a supracondylar area, so it's above that condyle. Yeah, so let's have a look at that. So there's your median lateral that we've had a look at. There's a little bump there called the adductor tubercle. Remember I said that tubercle, trochanter, tuberosity, they're all names that are given to bony lumps, okay, depending on their size. Then we've got the supracondylar ridge, or the supracondylar line. So this one's on the medial aspect, so it's on the inside towards the midline. Supra means superior, and it's supracondylar, so it's above the condyle. All right, so that's that bit just there, and then this line up here is the supracondylar line, and that will be useful later on when we start looking at muscles, okay, and blood supply actually. Okay, and then if we come around to the lateral side, so there's a really good view of the knuckles. There's a lateral supracondylar ridge or supracondylar line as well. So you can see just this raised area here. So if you grab hold of a femur from a skeleton, anatomical model, then you can feel these condyles. Okay, they're usually even on the cheaper versions you can feel them. They're usually not smooth. You can feel the bumps. Okay, and there are things that attach into here that have created that pull and that ridge. Okay, so that's your condyles and the supracondylar ridges or supracondylar lines. Okay, cool. And then let's have a look at some of the joints. So this is the tibiofibular joint. So this is the joint between the outside bone and your shin bone. And there it is there. So there's your fibula. So that's the shaft of the fibula we were just looking at on the previous image. There's your tibial tuberosity. So that's the bony lump at the front of your shin. Fibula head just there, and then you can see the join in between the two, and then there's a gap in between the two. And when we were looking at the ankle of the foot and the foot, that gap is filled with the interosseous membrane. Yeah, we'll go over that when we get to the connective tissue. But if you've already done the foot, then that will make sense. So yeah, there's your tibia, there's your fibula, that's your tibiofemoral joint, so the joint between the tibia and the femur. And then this one up here, that's the joint between your tibia and your fibula. Okay, so proximal because it's closest to the body. And that's that joint that I said you can grab hold of and you can give it a wiggle. Okay, so that's that one. These are the tibial condyles. So we'll do this one and then we'll go back to that PowerPoint and have a look at the rest. So your tibial condyles are important later on for connective tissue that is around this area here. So we've got a medial and lateral condyle, and then the intercondylar notch in the middle. So this is where your meniscus will sit, and you may have heard of those, but we'll cover those later on. So it's quite flat. So that area there, because it is flat, just pause that there. So because see, inside and outside, because they're pretty flat, they're called a plateau. Okay, so a flat region is a plateau, and but then the middle bit where it's bumpy, that's your notch, so intercondylar notch in the middle, and that's where your cruciate ligaments attach. So they attach into there. All right, so again, as we start to add on those layers, we'll be able to see those. So interarticular area or intercondylar area there. Cool. Okay, let's have a look at this again. So we did the left side. I'm going to have a look at this right side. So there's the plateau, yeah, just across there. Medial condyle is there, so we've already had a look at that one. And then we've got this really weird name of something down here, the pesancerinus. Yeah, that one just there. Pesancerinus means goose foot. Yeah, and you're thinking, why the hell is something named after a goose's foot? Goose's feet have got 3 prongs on them, so and then there's webbing in between. And basically we've got 3 muscles that come down into this area here. And when you dissect it back, it looks a bit like a goose's foot has stepped on that particular area. Okay, and the 3 muscles, we'll look at those later, but I'll just I'll give you a little clue. They're called the Sargent group. And if you shorten down the word sergeant into SGT, okay, so when you, instead of writing it all out, you just put SGT for sergeant. Those are the muscles, your sergeant muscles, that attach into that area. So we'll have a look at that when we get to those. Medial border of the tibia, just here, so that's the inside border of the tibia, and then the front border of the tibia just there, so that's your anterior border. Okay, so that's the kind of whole view of the tibia and the fibula at the knee. So let's have a look at these last bits. So we've got the tuberosity, so that bony lump at the front, and then the proximal part of the fibula. So there's your tibial tuberosity right at the front. Fibula is missing at the moment, so you can see the shape of the joint. See the angle at which the fibula sits in there. And
okay, I found this on the web, for which the fibula sits.
Thank you, Siri. And then this is your this is the shape of the fibula as it sits in. So you can see, hopefully, how you can only get one movement out of this joint. It's only going to be able to go backwards and forwards. It can't go up and down because there's a ridge. Yeah, so the tibia will come across like that, and then the fibula will slot in. So if there's movement up and down, that's would be very unusual. There's usually some kind of injury, some kind of rupture of ligaments. But the normal movement of it, so the physiological movement of it, is backwards and forwards. Okay, so anterior, posterior. You'll get a bit of a glide out of that joint, but it won't go up and down. It will go backwards and forwards. All right, and you can try that on a willing volunteer. If you do treat people, you can grab hold of the fibula head and just give it a bit of a wiggle. Interosseous membrane just sits in there, and then, like I say, tibial tuberosity at the front. Cool. Perfect. So that kind of explains all of those. And then one of the last things we need to look at is the patella. So if we have a look, this is one of the images from the Trail Guide to the Body that I was talking about earlier. So if you have someone bend their knee off a couch or off a chair, you can feel most of the structures at the front of the knee. Okay, there's obviously bits that you can't get on top of, like the tibial plateau. You can't feel that because it's too deep, but you can feel a lot of the bony landmarks. So if we have a look here, obviously you've got your femur there, and then the condyles, so that these will be your femoral condyles, and then the patella sitting on top there. Now the patella is shaped like a dome at the top, and then it's pointy underneath, so that it fits in between the two knuckles. Yeah, so it slopes inwards like that, so it can glide across that groove. Okay, so and that's so that it doesn't pop out. Yeah, it can dislocate. There are conditions that you can have where the shape of the patella or the laxity of the ligaments or a trauma will cause it to dislocate. But because of the shape of the patella, because it's in like that, it should sit in that femoral groove. Okay, and it should just go up and down that groove, happy. Yeah, it's a synovial capsule, so there's lots of synovial fluid there to help with the gliding motion, but that's what should happen in a normal patella. And then you've got your tibia just underneath, so you've got the tibial tuberosity, and then your tibial condyles either side, and you can kind of feel Gerdy's tubercle. It is a little bit more raised on some people, but it's usually just a tender area, yeah, that you can feel. And then medially, you can often feel the tender area that's the pes anserinus as well. There's no real bony lump there. It's because it's quite flat. That goose's foot is quite flat, so it hasn't got the kind of pull to create that bony lump, but it's often an area that's quite tender. So you would find the tibial tuberosity, and then from that tibial tuberosity you'd move medially onto the pes anserinus or laterally onto Gerdy's tubercle. And yeah, so there's the on this one it's called the tibial tubercle. Okay, so just there as well, and then the tibial tuberosity. So the tuberosity is a little bit bigger. In anatomy, I've been saying this over the last few weeks, we're trying to get away from using people's names. So like Gerdy's tubercle, it looks as if it's being switched into the tibial tubercle instead, which makes sense. Then we've got the fibula head just here. So if you feel that tibial tuberosity move towards the fibula head, Gerdy's tubercle is kind of in between those two. All right, so you can, if it is tender, then you'll usually feel it in there. And then, like I say, the patella from before. Now, the patella is really useful. Oh, there we go. That's the trial guide. Yeah, so it shows you where to go. So the patella is really useful because it creates a lever so that the muscles don't have to work as hard to extend the knee. So let's just have a look at the patella. Do this one to finish off. Okay, so there's the base at the top, apex at the bottom, lateral condyle of the femur, fibula head. Okay, so the patella itself is encased within the tendon, and then here's the shape of it. Okay, so there's grooves in it. So you can see it's a little bit flatter either side, and then there's a groove in the middle, or a kind of raised area in the middle, and then grooves either side, so that it then fits in between the femoral condyles. Yeah, like I was saying before, so hopefully this makes it a bit more sense. And this is a really good video that I found a little while ago. So someone has put a spherical object there to represent the patella, 2 bits of wood which are meant to represent the femur and the tibia, and then the elastic band which is meant to represent the tendons. If you have a patella in place, I'll rewind it a little bit so you can see, but it's really easy for the elastic band to move this part of the wood, so the tibia section, but without a kneecap, you'll see it hardly moves at all. So let's just rewind that a little bit, and then you can have a watch of that. And this is what the kneecap does. So look at it's effortless to lift that distal piece of wood, whereas this one, it just ain't going anywhere. Okay, but when you put the kneecap in, it moves. Now that bone there, the patella bone, is called a sesamoid bone because it's shaped like a sesame seed. And there are several sesamoid bones in the body. There's another couple underneath the big toe, and your muscles that go underneath the big toe are those sesamoid bones are embedded in those tendons as well. So when you are using those muscles to flex your big toe and push off, which takes a lot of effort because you've got to move your whole body, those sesamoid bones help to increase the efficiency of those muscles, similar to the patella with the muscles in your thigh. So that's why they're there. The ones underneath the foot can get irritated, just like the patella. So you can have tendinopathy issues in the patella, and in the foot, the sesamoid bones there, you can have a sesamoiditis. You can get inflammation of those bones, irritates those bones, and a good idea to get someone to see a podiatrist if you suspect those kind of things. Cool. There you go. So that's bones and joints of the knee. What we'll start to do next week, add on the connective tissue, and then so we'll look at the ligaments, the meniscus in a bit more detail. Obviously I've alluded to it today, but we're going to cover those in a bit more detail next time. And then we'll slowly start to add on the tendons, the muscles, and then into the blood and the nerve supply. Brilliant. I'll see you next Monday, 10 o'clock. See you then.